ICE Health Systems gives you the tools to accomplish many different things. However, we usually talk about each tool or feature separately. So today, I'm going to show you how multiple parts of the system can connect. We'll walk through a simple scenario where a patient arrives for their first appointment, and we'll see how everyone involved might use different parts of the system. For the sake of time, I will use a patient record that is partially completed so we can see as much of the system as possible. If there's a specific area you want to learn more about, at the end of each section, I will highlight advanced workflows you can look into by using the help material or by attempting the workflows yourself in a training environment. Let's get started. The first thing I'll do is log in as a person working at the front desk so we can get the patient checked in and ready for their first appointment. So I'm going to start by going to my schedule and we'll find this appointment with our patient Devin today. So we can see on the schedule here that Devin has an appointment for today with Shivani Chandra, our provider. This particular schedule view is set up with chairs and resources beside providers. So as I scroll through, I can see some providers, and it's also showing resources and chairs from all of our clinics. So we've got our community chair and oral surgery chair for the community and oral surgery clinics, as well as our provider Blair, who's working in oral surgery today. So I've got these all set up side by side, but if I wanted to, I could switch to a view that was only our providers or only a specific clinic. So the Glenmore Court Clinic, for example, only shows this much information. So I'll leave it here. This is where we'll be working from today. So I'm going to select the appointment here so that we can see more details about Devin's appointment. We can see who it's with, what the appointment type is, and what treatments are associated with this particular appointment. I'm just going to check really quick by selecting the ellipses on Devin's card, just to make sure we've got an address and phone number in here, because we want to make sure we've got that now, which we do. So I'll close out of here, and we'll mark the appointment as patient arrived now that Devin's here. So I'm going to load Devin's record really quickly. He's showing at the top of my list here because we were just looking at his record. So I didn't need to search in anything, but I still used the search field to open his record. And I'm going to go to the patient management area. This is a very similar view to what we were just looking at from the appointment, but I want to go to insurance here and get him set up with his insurance policy. So it's a dental policy, so I'll select add dental policy and I'll search for it. So this is a policy that was entered into our system already by our financial team. So I just need to enter either the group number. In this case, I know the insurance address code, which is IDAB, and I can see some more information on the card here. So I'll select this one because I know this is the correct group number, and I can confirm it's the employee group policy that I'm looking for. So I just need to add his subscriber ID and the effective date, and we're good to go. So once I add this, I'll get a bit more information showing up here. There's a little card for the insurance policy I just added that'll show our ortho and non-ortho limits. Any details about deductibles or copay will show up here as well. Now the details for this policy with the different coverages, exceptions, and so on, this was all configured at the practice level by our financial team. So I won't look into that here, but this will be the policy that's going to be used when we add some procedures later on. So I've confirmed that we've got the demographic information in there. I've added the insurance policy that he'll be using. And the next thing I want to do quickly is just go to the relationships section here and connect Devin with the provider Shivani Chandra, who's going to be his primary provider. Relationships let me connect different people in the system together. So you can see some examples here for emergency contacts or family members, if there was an option for a parent, for example. But I'm going to use the is a primary provider. So we're saying that Shivani is the primary provider of Devin. And once I add that relationship, it'll show up here, of course, and then also in the info tab of the patient's sidebar, we can see that information and it'll list other relationships as we add them. Now I don't need to go and add this same relationship to Shivani. We just need to add it here once, and then it's showing up in both places. So I'll go back to the demographics and double check any of my custom fields. There could be any number of custom fields here based on how the practice settings were configured, but there's nothing I need to update right now. So I'll go to Devin's dashboard, and we can see his appointments showing up here in his next visits panel. So I'll select it so that I update the appointment status to checked in, and we'll be good to go. So that's everything I wanted to cover for the check-in section. If you wanted to explore some more advanced topics, you could look into setting availability. So when I was on the schedule grid, you could see where people or chairs were available at different times, and that's something you could configure in practice settings. You could look into scheduling specific time slots within appointments as well. So if you have a recall appointment, you can have it so that only 15 minutes is required for the dentist exam, and that way only 15 minutes would show up on their schedule, instead of the full duration of the appointment. You could look at defining more relationships or associating a secondary insurance policy, as well as creating and managing the details of those insurance policies. So now that we're done with the check-in step, I'm going to log out as Corinne at the front desk, and we'll log in as our clinician for today, Shivani Chandra, and continue the appointment with Devin. In this section, I want to gather some clinical information about our new patient, Devin. So I'm logged in as Shivani, our clinician for today. For this scenario, Shivani's account is set up to require validation. So all the work I'm doing here is going to show up in a validation area for our supervisor to review at the end. But as I'm working, I don't need to change the way I'm entering information. The steps are the same as a person that doesn't require validation. So I see my provider dashboard when I start, and I've got two panels right now. One is a list of the records I've looked at recently, and then I also have a list of my appointments for today. So of course I can see my appointment with Devin that we were just looking at. And from here, I can look at details in the appointment or update the appointment status, just like we were doing. So let's say that Devin is now seated, no longer in the waiting room, and we can get started. So I'll load his record, and we'll see the dashboard. Now my dashboard is set up a little bit differently than it was when I was logged in as a scheduler. So this is my information gathering view where I've focused on my vitals panels, my documents panels, and so on. I'll be switching panel views later, but for now this is the one I want to work in as we start gathering our initial information. So I'm going to start off with the documents panel, and we'll take a look at this health history form. Now this form was auto-assigned when Devin's record was created based on the rules set up in practice settings. So I just need to select it and we can start looking at filling it out. Now it's been partially filled out already. So I'm just going to highlight certain types of questions so you can see what types of input options are available. Now this form and any other document template that we'll be using are all configured inside the system. So this particular one was set up for my practice, but it could be different depending on how you configure your practice settings. So you can see at the top, we had some data hooks pulling in information, but Devin's date of birth, name, as well as the provider information and the date. So as I scroll through, you'll see different types of questions, and I'm going to focus on the first type here with a health fact in it. So a health fact refers to this little yellow square here, and in the system, it's a way of recording information about a patient. So this particular health fact for hypertension appeared when I answered yes to high blood pressure, and then it opened up an option for me to type in some text to say that in this case, the hypertension is controlled with medication. Now, the reason a health fact is important is it's an option you can include in a form like this so that when the form is locked, the health fact will appear on Devin's record in the patient sidebar there on the right. So these health facts are highly visible when you're working in a clinical setting. So this is one way that the document can react to your input. So in this case, I had said yes, and it showed hypertension, and then showed me this detail option. But I'll show you another example as well that we've got here for diabetes. So in this case, when I filled out yes in this option, it's showing us the health fact for diabetes. And then we have these options to select more details about the diabetes. So these options were pre-configured and helps with consistency and time because I didn't need to type in the answer for diet-controlled diabetic. I also didn't have to remember what options were expected here. I could just choose from my list. Now with these health facts, there's three types. You've got medications, conditions, and allergies. So those could be added to any of these questions here as I'm filling out my health history, and we'll see how those show up later on. So the last example I wanted to look for the health fact was medications. So in this case, I searched and selected for warfarin, which is the medication that Devin is using to control the hypertension. And one of the different options here I'll show you is that I can select it to see more information about this health fact. So this is the view that you would have accessible when you're selecting a health fact from the patient sidebar later. So you can see earlier I added a note about the dosage, so it's 2 milligrams per day. And I can make a choice here to help highlight the significance of this to our work. So I'm going to mark it as a high significance because I know warfarin is a blood thinner. And if I wanted more information about it, I can use the Lexicomp integration to learn more. So I'm going to select the Lexicomp monograph so you can quickly see what that looks like. So there's a lot of information, but I'm going to use the table of contents here on the left because I'm specifically interested in the effects with local anesthetic, effects on dental treatment, and bleeding. So I could double check that information here, knowing that warfarin is a blood thinner. If I wanted, I could copy this text and then paste it into the item note if I wanted that as a reminder, but of course it's always accessible right from here. So I'm going to say I'm good with this here, just updating the significance. So I'll mark that as saved. And then once again, once this form is locked, then that information will show up on Devin's record there on the right. So the last question I wanted to show is down here in the personal section of the history, and it's about tobacco use. So you'll see as I answer yes to do you use tobacco, we get an expansion with some more options. So I'll choose cigarettes. And then we're seeing a health fact for smoking as well, which is great. So we can add information there. I'm going to say 0 to 10 and respond that Devin has tried to quit before. So what you're seeing is an example of a question that is branching but goes into a lot of detail. So some feedback that we've received from folks before is that often in this particular example of smoking cessation, it can be disruptive or frustrating to have to open up a completely separate form to go through that questionnaire or that coaching. And it would be really helpful to have that information directly in the health history. So that's where this originally came from. And you can see that when I mark yes here to the question of whether Devin has tried to quit before, it's adding some prompts or some scripts to help me have that conversation with him. And if I say yes to are you interested in quitting in the next 30 days, it continues with that as well. So the other feedback we've received from folks is that it can be very difficult to have smoking cessation conversations with patients in the moment. They're in a healthcare setting. Sometimes they might feel intimidated, or the clinician doesn't want to come across as condescending in this healthcare context, specifically around this. And so, this is a way of supporting the clinician as they're working so that they can help validate the patient's experience and give them advice that is relevant to their dental health. So, you can see I have certain prompts for yes, but if I select no, if Devin's never tried to quit, it changes a little bit, just a validating statement again, and then probably not goes into even more detail with an approach option if that's something that the clinician would feel comfortable talking about. But at the very least, they've got these resources right there, right as they're asking these questions, so they can seamlessly integrate that conversation into the experience rather than having it as a separate form or an extra conversation at the end. So those are the questions I wanted to highlight here. I obviously haven't filled out the entire form, but this is just one way that you might do it. Because we're looking at validation later, I will submit and lock this form right now so that it can be reviewed later, even though it's not complete in this case. All right, so that was the first example of a document I wanted to look at, but I'm also going to fill out a new patient exam form. Now this one wasn't automatically assigned, so I'll have to pick it myself by going to the Documents panel, selecting the menu and saying New Document, and I'll just use the filter to search for my new patient exam form. So this form was configured to bring in the chief concern, extra, and intraoral exam steps from the new patient exam appointment. Again, it's based on a document template that was configured in practice settings here. And so as I put in some answers, you'll see some pre-configured options as well as places to type. So for example, with the chief concern, we could say Devin's chief concern was pain. And you see, get more options. So I could say it was in the upper left, and it was a dull ache that was intermittent, and the pain level was slight. So that's one option of putting in that information. We could say too, if there was an appearance concern as well, that opens up some options. So we could say color, and then I can type in this new field, say in quotes, to say that he just wanted whiter teeth. We'll mark that one. And then if health was also a concern, we have some more options, but in this case, let's say just maintenance, because he noted that it was just time for a catch-up. For the sake of time, I won't enter more data into this form now that you've seen that as one example, but the same concept applies to the extra and intraoral examinations here. You could choose different options and then you get measurements and places to write text as well, so that you've got some consistency as well as hopefully some time saving, because folks don't need to remember the exact terms to use and they're able to just click their options instead of typing them out completely. So I'll lock this one as well and submit it for my validation later. Even though it's not complete, we'll see how that looks in a little bit. So I'm going to record vitals again. Let's say they were taken a little bit earlier here, so that's where these initial values were, but I'll update them for now. So I have the option to change how this information looks. So for example, I could show it as a graph, and you can see when I entered the second value there, it started to create a bit of a visual representation for me. So when I hover, I can see the details at each time. Or I've got a little history option here. So if I select that, I can see what the values were when they were entered at different times. And that'll keep updating as I enter more and more over time. So let's say I'm done with the vitals and the document steps here, and let's take a look at some radiographs that were uploaded earlier. So I'll go to the imaging area and we'll see Devon's imaging. Now in this example, I've got 4 bite wings up, so these were captured and uploaded into the system earlier. And we're looking at them in a particular template view here, but there's different ways that we can look at them based on either templates. So I can see, for example, our general dentistry master shows a different view. It's still the same images, they're just organized differently. And in this case, I've got one set up for OrthoMaster. It doesn't have a spot for the bite wings, but they're still there. So I can go to our editor to see all the photos that are active in the current view. So in this case, it's just the one. But in the browse view, I can see all the labels that have images as well as all the time points. So in this example, I see all the images that were uploaded today, and it's very quick to just throw them up into this browse view here. You have lots of options for different layout types depending on what you're working with. And in the future, let's say I was looking at the label for the left molar bite wings. Once I had multiple time points, I'd be able to see all of the time points for this label here and quickly put up the images for comparison if that was helpful. Then of course, if I double click any of these images, I get the standard image editing tools. So I have color brightness options. I can also annotate and draw on these images as well. So that's a really quick look at the imaging options here. I'm going to say we're happy with how this went and now look at entering some findings in the charting area. So I'll go to charting and we'll get started. So to start off, when I went to charting here, I'm looking at my treatment planning view that I have. So in this case, I've got my treatment planning panel, and this is where I'll be adding some findings and procedures and then organizing them into different phases. So in this case, our phases are set up as emergency, acute, and disease control, etc. And we can create different treatment options to discuss with the patient as part of our appointment. So in this example, under disease control, I've got a finding or a diagnosis already documented. So that was for the caries on the 3M, and then a proposed treatment of a resin restoration on the 3M as well. And if I wanted to, I could add more options, but we'll take a look at an example in a little bit here. And then in the maintenance phase, I've got the 2 procedures associated with today's appointment, so the bite wings that we took, and the evaluation code as well. Now, these aren't associated with a particular diagnosis. They were just added as planned earlier. So I'm going to start by recording some findings here. So I'll select Add Finding, and we'll see our options. So to start off, looking at this odontogram, it doesn't quite match what I'm seeing with Devon, so I'm going to make a few changes to the dentition quickly. So if I go over to the bottom right corner here, I've got an edit mode that I can enter for our odontogram, and we'll make a few quick changes. So I can select multiple teeth here, and what I'm going to do is select these 4 and quickly just mark them as missing. Great. And then once that's done, I'm going to select our tooth number 11, and in this particular case, I'm going to select the replace option, and that's going to switch our permanent 11 with the primary H. Now that's all I wanted to do to change up the dentition, so I'll leave out of there, and we'll be good to go. So I'm going to enter some materials that I'm seeing in the mouth. So I'm going to go to the material finding section. We're going to say that we're seeing some old fillings. In this case, they were amalgam ones. What I'll do is you can see when I hover over tooth 3 here, I get options to select. And I'm also seeing something on 31 and 30. So I'll make those choices really quick. And when I save these, it's not going to add one entry with all this information. It'll add 3 different lines, one for each tooth. So we've got that separate in our procedure list. So I'll say save and add new so that we can add more information afterwards. So we added some examples there where I was selecting multiple surfaces. So I'm going to do a quick one here for a crown that appears to be gold. And we'll just select an entire tooth. So that'll be tooth 4 where that crown is. And we'll do a save and add new so we can continue to the diagnoses now that that's entered. All right, so let's take a look at adding some diagnoses. So I'm going to start by searching through my diagnostic code sets for some options. So I'm interested in looking for gingivitis. So I see my results here from my SNOW-DDS diagnostic code set that I've set up to use in practice settings. So I'll pick my gingivitis option. And in the previous example, we select some surfaces, but for gingivitis here, I'll just record that as a general diagnosis. It's not associated with a specific location in this moment. So that's great. And once that saves, we'll take a look at adding some caries to specific sites as well. So we'll start looking for some caries codes next. And when I search for caries, the first set of results I see is from my caries classification. So these are the ICDOS codes, and then you see the SNOW-DDS options below. So in my practice, I've configured to use the caries classification codes, and then the SNOW-DDS ones are my primary. Now, I have the option to see other code sets as well. So if I search secondary by selecting that checkbox at the bottom, it'll search any secondary code set. So for me in this case, the ICD-10 codes are set up as a secondary code set. So those options are always there if I want them. But in this case, I want to use my caries classification. So I'll choose my moderate active and associate those. So for 30, seeing new caries on the MOD, and on the 31, just on the mesial. So I've got those options there. And just like I've been doing, I'll hit save to add 2 entries there for our caries. All right, so now we're back looking at the treatment planning panel, and you can see that our new diagnoses that we've just added are showing up here on the left. Now, the material findings that we saw, so the amalgam fillings in the crown, those don't appear here in treatment planning because we're not going to do anything with them, but we'll be able to see them on our odontogram as well as the general procedure list. They are listed here too. So I'm going to scroll back up to our treatment planning panel. And before I start planning what I want to do with these diagnoses, let's go to the perio section to finish our gathering step here and look at some perio measurements. So in this section, you can see the periodontal odontogram with some visual representations of the measurements here in the bottom left. In this example, I did pre-enter some information, so you didn't have to sit and watch me do that. So that's where the visuals are coming from. You can see on the right here, I have some display options, and I can use these to simplify the view because obviously it can get quite busy. This might be helpful if you're having a discussion with the patient about the measurements and you want to focus in on certain values. And then of course, if I scroll down, there's a legend explaining all the different visual drawings and what they represent. In this case though, I'm interested in the data entry, so I'll select enter data and we can take a look at what those values look like when they were entered. So we have all the different data types or measurements that you can enter here in the data entry screen. But when I select a cell, it emphasizes where I'm at, so it's easy to see whilst I'm scanning. And as I enter values, the cursor tabs forward in a particular order. Now there's a default order that is defined in practice settings, but we've got 5 different options that came from our perio working group. So whether you're going around a tooth or you're going arch by arch and jumping between, there's different options to choose from. As you're entering the values, the options for plaque suppuration and bleeding can be entered with keyboard shortcuts as well. So you don't have to click the little circles for the different items, but you can go back and select the little bleeding icon later if that's coming up later in the exam and it wasn't there when you did your initial probing. So that's all I wanted to show on this one here, so I'll close out. And that takes us to the end of the gathering information step I wanted to look at. If you're interested in more advanced topics related to gathering information, you can look at how document templates are created in practice settings. Obviously, not every template needs to be as detailed as the new patient exam form was, with extensive branching questions and predefined options, but there's flexibility there for you to decide what sort of forms work best for you. You could also look at the different periodontal tab order options, as well as exploring how to enter perio measurements. You could look at the SNO DDS and caries classification options that we have in code sets and see what sort of results those show when you're trying to enter diagnoses, as well as looking at the ICD-10 examples. And finally, you could look at some of the more unique dentition changes that are available. We just marked some teeth as missing and replaced a primary with a permanent, but you can also look at adding supernumerary teeth, swapping locations of a tooth, and so on. Now that we're done with the gathering information section, we'll move to the next step, where we're taking those findings that we've entered into treatment planning and figuring out how we're going to organize them and come up with a treatment plan. I'll go back to general charting so we can see our treatment planning panel. The first thing I want to do is move my diagnoses here into phases. So I'll start by moving the 30 into disease control. And when I let go, you can see it appears below the caries that we'd previously entered for 3 and associated with that 3M resin restoration. So if I wanted to associate some treatment with that, I've got a few options. The first is to select the plus icon here, and we can search for a code that we'd like to add. So our 30 and our surfaces are selected already, and the codes are filtered. So I'm just seeing the posterior options instead of the anterior ones. So I'll select my code for the 3 surface, and we're going to put that into option A. I'm going to mark that as save and add new because I also want to add something for our option B as well. When I add these for the first time, they're going into a proposed status. They're not completely planned just yet. I can add them as planned if I'd like, but in this case, we're trying to be flexible. So once I've got this item in, I'm going to add something to my option B as well. So in this case, I want to look at adding a porcelain crown as our second option. So I searched for the code instead of searching for the description. That's where I got the 2740. But what I want to show off in this example is that we have a step set for this particular code. So if I select that, what that's going to let me do is plan out the steps to deliver the crown separately instead of being just one step that is either in progress or completed. I want to be able to be a little bit more specific on that one. So we'll add our crown, saying it's not going to be a replacement, and we'll mark that as saved so we can see how that looks on our treatment plan. So now what you see is for our caries that was on 30, we've got an option in the first column for the 3 surface resin restoration. And in our second option, we have our step set for the crown. So instead of being one line, you see it's split into 4 because that's how the step set was configured in practice settings. And now we can have each of those steps be their own independent procedure, if you will, where you can mark them as in progress or completed separately, so you've got an accurate representation of what's going on. On some of these procedures, you're seeing this red exclamation mark. So I'll select that. What that's going to show me is the requirements pop over. So for this particular code, it requires validation because my provider I'm logged in as does require validation for treatment planning. And also this particular code requires a treatment consent. If there were other requirements like predeterminations, or if this particular treatment needed to be associated with a diagnosis, that would also show up here as well. But in this case, it's just these two. So if I were to select treatment consent required, it would start the process for creating the treatment consent form. I could pick the other procedures that we're going to show on that treatment consent, and then we could have that discussion with the patient before they signed. And that treatment consent could show a financial breakdown if that's how the form was configured, but it can also be configured to keep the financial discussion separate as well. I'm not going to get into detail on this, so I'll just cancel out before making that treatment consent, but that's where you could look into doing that later on. Now, for all of this here, we've got our different phases and options. You don't need to plan treatment this way. The phases can be configured to match their workflow, or you can choose not to use the phases at all and just add procedures on their own. One way to do that would be to still use the treatment planning panel with the green plus to add your procedures. Another, if I scroll down to the odontogram, you can add procedures from here as well as adding findings. It's the same window that you see, it's just a different place of starting. But I'll cancel out of here, so we're not doing that in this case. There's also a quick charting option. If I were to select a surface on a tooth here on the odontogram, it's showing me some pre-configured codes for commonly used procedures. So I could select, say, the resin 1 surface and mark it as proposed or planned if I wanted to, or if the options I was looking for weren't here, I could select search for a code to bring up the standard procedure input with that same surface still selected. So these are all options that you can explore when it comes to adding procedures, but I'm going to scroll back to the treatment planning section and we'll keep going. The next thing I want to do is associate these procedures with some potential appointments in the future. So I'm going to switch my panel view from my treatment planning view to my appointment planning view, because I want that next visits panel to show up beside my treatment planning panel. So what I'll do, you can see that I've got my appointment for today. That's the screening, and it's already got the exam and bite wings associated with it. But if I select the panel menu, I've got an option to create an unscheduled appointment. So an unscheduled appointment is just an appointment with a patient, a clinic, and a type, but it doesn't have a firm date set. So I know at some point I'm going to want a restoration appointment, but I don't know when, and I'm generally not the person that's scheduling them, so I'm going to put it here as unscheduled so that we can associate some treatment with it. So for example, I could drag the resin restoration from tooth 3 and just drop it on the appointment to associate it. And then let's say if we were to go with the crown option, I'll drag as well, and you can see it's bringing all the steps. But when I drop them, I can choose which ones. So I'll pick these 3 because I think we'll be able to get that work done in the same appointment, and we'll associate those. Now that still leaves one more for the delivery, so I'll create another. And this time I'll choose my appointment type for crown delivery because that's what we'd be doing. And now when I drag it over, I just choose delivery and we're good to go. So these appointments aren't showing up on the schedule as confirmed or anything like that. They will appear on the next visits panel for Devin on his dashboard if a scheduler is looking there. And there's also a section in the main schedule called the clipboard where these appointments could appear as well. So if a scheduler was working with the clipboard, they could search for Devin's name, see any appointments that were suggested, and drag them to times that were appropriate. So that's all I wanted to do for some appointment planning there and just figuring out what that might look like. Before we finish here, I'm going to mark the BiteWings code as completed. So when I select it, I get a quick summary view. I'll choose completed and save that one, and do the same here for the evaluation, because as I complete these, they'll now show up in financials as charges that we can look at collecting a payment against. I'll also update our appointment from today to completed, because I'll be sending Devin out to the front desk to be checked out. That's everything I wanted to show you for working with treatment planning. For more advanced topics, you could look at creating the full treatment consent form for proposed treatment. You could create more complex treatment options. In this case, we just had our 2 diagnoses that we were treating and a few procedures suggested, but you can build it across multiple phases. You can have more than just 2 option columns if that's helpful, and then have the conversation with the patient about what treatments you're going to go with. When it comes time to confirm or consent to treatment options, they don't all need to be in the same column. You can pick the ones across columns and have those show up on the treatment consent, and then the treatment plan will only show those once that process is done. Depending on how complex your treatment is, you can take a look at tracking a referral to another clinic as part of this process. We didn't look at this, but there's a separate referrals panel where you can create and track them as well. Now that we're done with the planning and delivering treatment step, I'm going to log out so that we can go through the checkout process from the front desk perspective. So I've logged back in as Corinne, the same person that checked in the original appointment with Devin and added his insurance details. So we're going to check out his appointment. He shows up at the top of my list here, so I'll select his name again so we can go to the dashboard. Now that we're back at the dashboard, you can see that unscheduled appointment that we added in treatment planning, and all the new documents that we added during the appointment are showing here as well, because in this front desk view I'm looking at, I've got those panels up here. But a new one I wanted to highlight was the financials panel. As part of the checkout process, I can see Devin's financial balances. You can see based on his insurance estimate, he's owing 100 for today with insurance owing 400. And then of course, the total balance is 500. So don't want to hide that information. But I'm going to record a quick payment here by selecting the Financials panel menu. We'll say make a payment, and we'll record a quick partial payment as part of the checkout process. So it was in our local clinic group today, our clinic Glenmore Court, and I'm going to say it wasn't the full 100, it was just 50. And in this case, it was a cash payment, and then we're good to go. Now in this simple example here where I'm making a payment, that $50 is going to be allocated on a first in, first out basis. If I wanted to be very specific about where that payment was going to be allocated, there's a switch to detailed payment button in the bottom right corner there that I could use to do that. Or we could look at reallocating that payment afterwards as one of the advanced workflows. But I'm going to say this $50 as a quick cash payment is good for me. So I'll select make a payment and we'll get that saved. So you can see that's updated the balance in his financials panel to $50, which is great. And the last thing I'll do with this panel before we're done is generate an ad hoc statement. Some people call it a walkout statement as well. So I just want something for today that's showing the activity in the local clinic group that we're working in. And when I generate that, it'll give us a PDF to look at. Now in this case, it's not going to have any branding because the statement is configured to print plainly, and then we've got branded paper to print on. But you can see it gives a breakdown of the treatment. We've got the billing information here as well. So in this example, you can see that that $50 cash payment was allocated to the bite wings. So that's leaving $50 on the exam code. So as I scroll through, there's also some balance summary information at the bottom. So that includes aging buckets. So in this case, we've got 4 buckets set up. And if we were to come back and generate this form in 30 to 60 days, then that $50 would have moved to the watch bucket. And you can see the estimated insurance balance shows up here for the patient as a reference as well, though of course the full account balance is ultimately $450. So I'll close out of here. I don't need to print it in this case. It's also been added to our files panel here for future reference, so we could reprint it or see what it looked like on this particular date. Now that we're done with the financials panel here, let's take a look at the main financials area so you can see what that looks like. So it shows a lot more detail, but you see it's got the same balances appearing at the top. On the left there, it's showing who the guarantor is and any insurance that's relevant. And as you go down, we've got our aging buckets again. Our action buttons are below for all the different activities we might want to do. And then we've got all our transactions here organized into tabs. So all those different tabs are essentially showing the same information, just grouped in different ways. So our main tab here is showing transactions by date. And then, for example, the payments tabs will only show patient or insurance payments, adjustments, and so on. One thing I will highlight is the detailed ledger. That same idea, it's just showing the transactions grouped, similar to how we saw them on the ad hoc statement. So there's a lot more that we could do here in the financials area, but I want to finish this checkout process. So I'm going to go back to the dashboard. We're going to mark the appointment from today as checked out and take a look at scheduling Devin's next appointment. So we'll see the schedule that we were looking at before. Just a little bit of time has passed. And now that we've got this screening appointment checked out, I want to take a look at making the next appointment for Devin in about a week. So on my mini calendar, I've got some jump buttons here at the bottom. So I'll use this +1 week 1 to go 1 week in the future. And on the clipboard, I'll search for Devin's name just to see if he's got any unscheduled appointments here. And of course, we'll see the 2 that we had planned out in the treatment planning process. So I'm going to schedule the restoration one first. It didn't have a chair or a person associated with it, but it did have those treatments associated. So I'm going to put it on chair B this time in the afternoon, and now it's scheduled. In this case, it just has the chair, so I'm going to double click and add Shivani back as the provider. We'll save that. And great, now it's showing up on Shivani's schedule as well. That's everything I wanted to go through on the checkout process. Some more advanced topics you could look at would be looking at the financial tools in more detail. You could update that allocation to a different charge, adjust the value of the charge, generate insurance claims, process and review those claims. You could look at managing insurance payers, as well as processing insurance payments or creating payment plans if you wanted to. Next, I want to take a look at running some reports really quickly. So let's say the patient has left, and as a scheduling administrator, perhaps a clinic coordinator, I want to look at some appointment reports for my clinic. I don't necessarily have to run the reports myself. I can just go to my practice dashboard where I've got a panel view set up already that has some reports that are running all the time. The report I'm most interested in is this numbers of appointments by clinic report. So it's showing me my 3 clinics, the Glenmore Court, oral surgery, and community outreach, and showing the number of appointments in the last week, the last month, and the last 6 months. So this is one that I find works well as a visual representation. I can see that generally speaking, Glenmore Court has way more appointments, which makes sense as our primary clinic, and I'm noticing that there hasn't been anything scheduled for oral surgery or in the community clinic. Now, since this is a report that was configured for me, it's all running inside ICE here. If I select the panel menu, I can view the detailed list version of it as well. So I can see all the appointments that were showing up here for last week, last month, and last 6 months, if that's helpful. But for me, I think this one works visually. So I'll switch it back to the chart. Same idea below. I've got different types of reports here. So on the left, it's another scheduling one, but on the right, I've got an insurance report. I was doing some research into the policies in our ICE Dental Alberta insurance address to see which patients had which policies. And so this was helping me look through that information and then look up their records as well. So these reports were all configured inside the system so that I could see them as panels rather than having to go into the full reporting area and be an expert there. That said, there's a lot of easy functionality in there, so I'm going to go to practice reporting, and we can take a look at that in more detail. So I want to look at one of the appointment reports. So you can see along the left here are the different data types that we can report on. So for me, I'm looking into the appointment reports and all the different templates that either I've made or templates that have been shared with me. So the number of appointments by clinic report is what we were using before, and that had been shared by someone else. So I'll use that report. And now when I go to the options area, I can see more details about how that report was set up. So for example, I can see what columns are showing up in the results. And if for some reason I want to know the appointment status of those appointments, as well as the appointment time, I can just add those. And the next time I run the report, it'll show that information. Now, this was a report template that was shared with me, but I can always make a copy of it for myself and tweak the details to work best for the type of questions I'm asking or information I'm interested in. Of course, this is all controlled with permissions and whatnot, so in this case, I do have the ability to edit all these reports. Another example of something that I could change is if I go to the search field section, I can see the details of how the report was configured. So it was just showing me all the appointments in the last 7 days, but if I wanted to, I could limit, say, to a specific clinic as one example, or all the appointments in the last 7 days with a certain status. So perhaps there I could look at all my canceled appointments in the last 7 days. Whatever it is, I've got lots of options here, and I could make my own templates that way, and then decide if this is a report that I want to run myself every now and then, or have it show up in a panel so it's really fast to check right from my dashboard. So that's what I wanted to go through, just a quick overview of the reporting. If you want to look at reporting in more detail, you can spend some time setting up a panel view with multiple reports, configuring some new report templates yourself, or even looking at the structured content from the perspective of reporting. Structured content includes the forms and documents that you can create and fill out, and those can also be reported on here. So you can explore what types of data you might want to collect in a structured form, and then how you might want to report on that afterwards. The last thing I want to review is how you can support clinical learning and communication inside the system. In our scenario so far, we've had the patient show up for their first appointment. They met with a clinician who entered some forms, some vitals, perio data, and some treatment planning before the patient left. Now, in this case, Shivani Chandra was our clinician and was set up so that all of her work would be validated later. This wouldn't be the case for everybody, but in this case, she has a supervisor that is looking at her work and then communicating feedback about it afterwards. So I'll start by going to the provider validation area, because in this case, I have access to validation. And what we'll see is a list of activities and people that I'm able to validate. So in this case, it's only Shivani, and it'll show all her interactions with any patients. So in this case, it was just with Devin. So that's the work that we were doing earlier today. So if I select view, I'll get a list of all the different things that we did earlier. So for example, we can see the charting information. So we've got our procedure list up here. We can look through the details as well as see the visual on the odontogram. And if I scroll the list, the health history form will show up like we filled it out. Same with the new patient exam form. The perio charting measurements also show up, and the vitals that we entered will show up here as well. So if I wanted to, I could select the different items and mark them as validated. And say in the example of a form, then any health facts would be approved and show up on the patient's record. In treatment planning, any of those treatments that had the red exclamation mark would then get a nice green check mark, so everybody knew that those were validated. But in this case, the new patient exam form, we know that it wasn't completed completely. You can see that the extra oral exam section wasn't completed. So I'm going to send a quick message to Shivani as a reminder inside the system. So to do that, I'll go to Collaborations, which is our internal messaging system. So I'm going to send a new collaboration. It'll be with Shivani, and it's going to be about the patient Devin that she was working with. And I'm just going to make a quick subject of incomplete. So I'll say the new patient exam form was incomplete. Please finish it so I can validate. So I'll select create to get that collaboration started, and a message is sent to Shivani. So she would see a new entry in her collaborations area. As well, the envelope icon in the top would get a little red number 1 on it to say that there was a message waiting for her. And to respond, she'd just have to select the field and type something. So actually, I'll type a response because I forgot to say thank you, and I'll send that. So that's one way of communicating inside the system. Another option would be to use our telehealth service to have a quick video chat with Shivani. So I'll select telehealth here, and I'm looking at my telehealth area. I see I've got a few sessions already, but I don't have one specific for Shivani, so I'm going to start one really quick. So we'll say start a session. I'll add Shivani, and I'll select OK. I confirm the message that anyone I give the link to can join, which is fine because I'm not going to share it with anyone except for Shivani. And it takes me to the camera preview, so I can turn my video or audio on or off, and then join the session. So what will happen is Shivani will also get a notification in the top right that she's been invited to a telehealth session. And perhaps if we'd agreed upon this time in advance or this was a regular meeting, I just have to wait for her to join and we could have a chat about the record. We could share video and audio, of course. I could also share my screen so we could be going through the record together and looking at the exact same thing. And I could also add an additional camera. So if, say, rather than in a validation example, but more in a patient exam example, if I had a USB intraoral camera, I could add that to the telehealth so that Shivani could see what I was doing. Those are the things I wanted to cover for supporting clinical learning through validation and communication inside the system. Some advanced topics you could look into include sharing your screen, floating your video, sharing multiple video feeds, as well as using external USB cameras and then capturing images from those cameras that are saved to a patient's record. For validation, you could look at reviewing more detailed validation entries or only partially validating work, as well as seeing how the validation indicators, those red exclamation marks or green check marks, appear and disappear on a record as it's validated. That's everything I wanted to go through in this series. We covered a lot in a short amount of time, so as a quick recap, we looked at checking a patient in for their first appointment, updating that patient's demographics and making sure their insurance policy was added. Then we got them seen by the provider, who reviewed their information, used some forms to gather clinical information, entered vitals. Then we looked at recording diagnoses and material findings and charting. We entered some perio data, and then planned out how we wanted to treat the diagnoses that we'd entered, and created some options for what that treatment might look like, including associating those treatments with potential appointments in the future. Then we had the patient check out, where they made a quick payment. We created an ad hoc statement to give them, took a quick look at their financial record, and ran some reports on the dashboard. And then finally, we messaged about the experience between a mentor and a mentee by looking at the validation area and sending a collaboration message. And then we started a telehealth session at the very end that we could have used to chat with Shivani, the clinician in this example. So that was a lot to go through. Thank you for taking the time to review the system with me. Hopefully this gives you a sense of the many things that you can accomplish and how different parts of the system can connect. I encourage you to explore the help material that we have available to learn more about the topics that you're interested in. And of course, please do try these workflows yourself and their advanced versions in a training environment.